A disturbing Black History Month fact. Black midwives used to be at the forefront of the U.S.'s maternity care until a coordinated effort led by men forced them to the margins.
Midwives have been around since the beginning of time. Royalty was delivered by midwives. Even the Bible mentions midwives. In the United States, historically, especially in the South, they really provided this encompassed community role to provide their communities with things that they didn't have.
Tracy Brown is a certified nurse midwife at a Washington, D.C. birthing center serving mostly Black patients.
Black midwives were brought from Africa during the slave trade to the United States and continued that skill. So we birthed our family's babies. We birthed the babies of the people who owned us.
In the late 1800s, midwives attended the majority of U.S. births, and most of those midwives were Black. By the early 1900s, midwives only attended about half of births. Today, only around 8% of births have a midwife present, and there's a reason for that decline.
The Shepherd-Towner Act, which was adopted in the 1920s, essentially made midwifery kind of like a federally funded statute. You had white OBs and nurses essentially grading older Black midwives. The work that they did wasn't valued, it wasn't preserved, it wasn't admired. Grand midwives slowly became to be phased out.
The U.S. had the highest maternal and infant mortality rates in the West because of systemic failures in healthcare. And it still does today, and for the very same reasons it did more than a century ago. Tracy says Dr. Joseph DeLee, an American physician who contributed to the field of obstetrics, reinforced the negative narrative around midwives.
Essentially came out with this research that said forceps deliveries were safer, or women being placed under twilight sleep was safer.
White nurses largely took over midwifery and were often in charge of supervising Black midwives. Research shows midwives can improve birth and maternal outcomes, especially for Black women. They are 3 to 4 times more likely to die from pregnancy-related complications than white women.
So it's not that Black women are flawed by genetics, it's racism. They're being treated differently because of the color of their skin. Just being a Black healthcare provider in the United States, that it's something for me to always remember that this is something that is my birthright.